Hi, in this video, I'm going to be talking about scar tissue after surgery and radiation therapy for breast cancer. Why does it develop? What does it feel like? And what can you do about it? Anytime we cut through the skin, there's going to be a reaction. This is, in general, a healing reaction where the cells, called fibroblasts, knit together to keep the skin and the tissues below the skin together. It's a form of healing. When scar tissue is exuberant, we can actually feel a thickness or an area that doesn't feel normal. It's not a nice flat scar like the kinds we get when we, cut our shin when we're little, because there's a really exuberant or enthusiastic response to the injury, especially in areas where there's traction on the skin. So any area where the skin is being pulled, so for example, the breast, which has gravity pulling down on it, or in the abdomen where we are doing a lot of movement with the abdomen, there's going to be a lot more strain and stress on the tissue, which can lead to scar tissue that is more raised as opposed to flat. This can be concerning if you are worried that this might be a recurrence of the cancer, worried that the cancer is coming back in the scar tissue. And for most of you, you're told, keep an eye on the scar. Let us know if there's anything abnormal. So it's totally understandable that scar tissue that isn't even, if there's one area that's more raised or more pronounced than the other, would be concerning. Never hesitate to reach out to your medical team, especially your surgeon. Even if you haven't seen them since the surgery, it's okay to go back and ask, is this normal? If they have any concerns that it's not, you're very likely to have an ultrasound or a mammogram or other tests to make sure that it is indeed scar tissue. Early on, after surgery, there might still be sutures inside the incision, and sometimes that can get really hard and knotted and form something called a granuloma. That's just scar tissue that is kind of bunched up. And you can often feel the suture material below the skin inside the scar tissue itself. These often resolve with time, but sometimes your surgeon may need to go in and take out that suture material. It's not that common, but it's also not rare. So if you have scar tissue and you're wondering, what can you do about it? First of all, it's important to honor the scar tissue. It's what keeps wounds together. Scars will fade over time. They start out very pink. There's a lot of blood vessels in there, and they do tend to fade over time. There's not a whole lot you can do to make them fade. Some of my patients have taken vitamin E capsules and cut them open and put that oil on the scar, massaging that in, and it may actually soften the scar tissue. Other things that can be done are massage, physical therapy, especially if you have scar tissue in the armpit after surgery in the axilla. Physical therapy can really help loosen up that scar tissue. That's different from just having the scar right where the tumor was removed. It's a lot more involved when we find scar tissue sort of decreasing the range of motion, if that makes sense. Then this is something with which you want to intervene. It can be really hard to look at your body and see scar tissue after breast cancer surgery. If you've had reconstruction and you haven't had nipple reconstruction, one of the things my patients have taught me is that after they have the nipple reconstruction, the eye doesn't go to the breast scars themselves. So I'm going to put my finger over my breast and show you what I mean. So after reconstruction, a lot of people have a scar here and a scar here. And without a nipple to look at, all you notice is the scar tissue. Once the nipple is reconstructed right in the middle of the breast, the eye goes to the nipple. And so the scars seem less prominent. Even if they look exactly the same, it's not where your eye goes when you look in the mirror. And that's what I've been taught by my patients. Most everything I say that's valuable on here, I've learned from my patients as well as my years of experience. Again, scar tissue that causes a decrease in the range of motion of your arm, you'll want to have attended to more quickly. Things like water therapy, swimming, water aerobics can really help loosen up the arm. But really, it would make sense to ask to be seen by a physical therapist or an occupational therapist. That can really help mobilize the arm and the shoulder. Not losing your range of motion is really important. This video we're doing because one of our viewers requested it. If this is helpful or interesting to you, drop a comment. Don't forget to click a like. What that does is it helps the YouTube algorithm give you more videos like ours and other people's related to this topic. If you click subscribe, you will continue to see new videos that we put up. We're always putting up new content. You can follow us on Instagram. We have a new Instagram page that went live. And don't forget to visit our blog for additional topics that might be of interest to you. If this is helpful, share it with somebody else. Thanks for watching.